The whole way of interacting with patients is influenced so highly by applied kinesiology. From step one, when we evaluate the patient and evaluate for the function and abnormal function, I mean, most patients have been to other practitioners. They've very often been from one specialist to another, and very often many different specialists. And one of the problems with so many different specializations is they don't always connect the dots. And what we do in applied kinesiology is to look at the patient who has the problem. And it allows us to look at the whole person, test the whole person in many ways, structurally, chemically, emotionally, to really find out what's malfunctioning in their body, and then that's what we work on correcting. But the process of doing that really connects so many dots. It's all about restoring, maintaining normal function in the body. Well, the first thing is that when the body is functioning properly, it produces the right chemicals that help to keep things balanced, that maintain health. I wrote a book entitled Your Inner Pharmacy, which the book is really about the thought process of applied kinesiology, but that title applies so much to when the body is functioning properly, and our bodies we're chemical factories. Producing good chemicals comes from having the right raw materials, having a healthy lifestyle, and having a properly functioning body. But there are many examples in so many ways the body can regulate and maintain health, and even more so, help with optimal function. And many of us in applied kinesiology have been so successful with elite athletes because we can help to get the normal function of the body and also really try to get optimal function of the body, which allows people to be at their best, whether they're an Olympic athlete or someone going to work and putting in a long day of really strenuous activity, whether it's mental, physical, or whatever. I think we keep getting better at connecting the dots. We keep getting better at the big picture and how different things in the body affect other parts of the body. So often, with so many chronic health problems, the problem, the pain, if it's a pain-related thing, usually the pain isn't caused by the area that's having the pain. The pain's coming from somewhere else. The pain's coming from a malfunction in the body or maybe a nutrient deficiency. We're getting better and better at streamlining the process of finding out where pain is coming from, where excess, imbalanced inflammation is coming from. So I'm not pointing to one single development, but the big picture is getting clearer. Well, I take it a step at a time, and first of all, I explain to the patient we're going to be looking at the function of their nerve system. We're going to be testing muscles and looking at biomechanics, but it's really not about muscles, it's about the circuitry. We're going to be looking at malfunctions in their nerve system. And I tell patients about how muscles turn on and turn off. The big misconception, I think, when people start dealing with muscles that are turned on is they think they're strong muscles, and muscles that are turned off, they think they're weak muscles. It's literally a normal neurologic process. I mean, if I'm going to flex my elbow, my biceps muscle has to turn on, but secondly, my triceps muscle has to turn off. When people understand that muscles turn on and turn off all the time, that's normal activity. It's very easy to see how injuries and malfunctions and traumas in the body lead muscles to be turned on sometimes when they shouldn't be and become hypertonic or spastic, and very often muscles turned off when they shouldn't be from an old injury. But when muscles aren't turning on and off properly, all kinds of things go wrong in the body, and people develop structural faults and people develop pain, and the thing that really fixes it the best is restoring the normal function to the nerve system, which controls the turning on and turning off of the muscles so they can stabilize the body. So those are some of the things I explain to people. Probably two levels I would answer that on. Level number one is giving me the knowledge, the expertise to be able to make corrections in the body, to be able to analyze function and malfunction, to be able to prioritize and know what areas of the body to not only to start with, but to do corrections on. So it's all of what we learn through Applied Kinesiology from other members of the International College of Applied Kinesiology. But besides the content of what we learn, the opportunity to be with other members from all over the world, all over the country, who practice applied kinesiology and are some of the most successful people in their fields. Just inherently, you're exposed to success. You're exposed to what works. People are, we're very often dealing with complicated health problems. We're sometimes dealing with very high-level athletes. We're sometimes dealing with very, very disabled conditions. But amidst all that, the vision, the ability to interact with people, the ability to use the human body as the laboratory that it is, and to test the human body and to find out what's malfunctioning so we can fix it. Those are all the things that really are the benefits of being engaged in applied kinesiology. In studying our healthcare system and what's really going on with the health of the American people, one of the astounding facts is that 78% of healthcare dollars are spent on chronic conditions. And what people don't realize is that chronic conditions, and most of those dollars, which that really amounts to over $2 trillion a year, most of those conditions are not conditions that people get infected with or they're not conditions, they're not diseases that people catch. They are conditions that people develop when their bodies break down, when their bodies fail to function normally. What we really should be doing, which would be so cost-effective and so beneficial to the health of American people and the people worldwide, is devoting ourselves to maintaining health. Everybody wants to focus on treating disease. It's much more powerful to keep people healthy than it is to treat disease.